If it won't reinflate on its own, then there's nothing else we can do.
Okay, so what she's doing is she's listening again to his lungs.
The right lung is intact. Left one is still collapsed, but it can take up to several hours with this method for it to reinflate. His heart rate is still good. If the heart rate was off, if he was having something we call arrhythmia, where it's an irregular rhythm, then it would be also another bad sign. If it speeds up and starts getting weak, then he's losing blood that we haven't been able to stop. We can't go into the chest. To do so is sure death. So the best we can do is try to tie it off and make sure. The good thing with this is that the bullet did go through, so we don't have a foreign object in the chest that we can't get to, but making sure that we tied everything off, that we got as much debris out as possible, and so on. And then to monitor him very, very closely. So we're going to want him resting a lot. You're welcome to stay with him unless you have to go back to your regiment. Okay?
And if you do, we're here, we'll take care of it. Okay? You can do this one, okay? Another one of the things that you had to remember is these things weren't readily cleaned. They weren't sterilized like they are today. So you were wiping it off and going to the next person. You had to do what you had.
The nature of wounds that they saw during the war, it meant that their skills were always expanding because they had more and more things they were facing that they had to figure out how to treat. You will see from the beginning of the war, if you read the medical textbooks like Bill and I do, just for fun, that certain things are mentioned at the beginning of the war, and there's a whole new set of topics that are included by the end of the war in the new textbook that's coming out, because surgery had advanced. There were many more things they had figured out how to do, ways to save limbs without having to just amputate them, depending on the nature of the wound. We couldn't do that with our lieutenant because the arm was dead. It had severed the blood vessels and the nerves. If it had not, then we would try to get him stable and actually remove the wounded part of the bone, put the two ends of the bone together and put him on complete bed rest for 6 to 8 weeks without it moving at all, in which case if it grew back together, he would regain function of that limb. That was something we did not know about when this war started, but it was something that we were able to figure out and come up with. Try, if all else fails, we can still take the limb off, but we were actually able to save many, many men's limbs this way. So we have lots of different herbs and so on that we would treat things with. We'll use poultices for respiratory infections. We'll use them on wounds. We'll use herbs actually in wounds or make tinctures with them. There's several different ones we have here. Who knows what willow bark is for? Well, white willow bark is actually the basis of aspirin. So we'll use this in hot water. We'll make a tea. We'll make them drink it. Bring down fevers. Start dealing with some minor infections. Yeah, y'all can come in now.
We don't fight hard.
I think oh, yep. Between tables. Thank you. Yarrow is a plant that is, most people think of as a weed. It has very lacy leaves and little white flowers that come up. There are different varieties of it, but the white ones are the most medicinal. You can actually see this has got some of the flowers that have been dried and crumbled and put in here. We'll pack wounds with this. This helps stop bleeding. This helps prevent infection. Just straight out of nature. Or that's very, very upset and they're having trouble keeping food down. This will actually help coat the GI tract and allow it to settle enough where they could start taking broth or start taking something like that. One of the things that the nurses are very, very important for is making sure they get the proper nutrition. We are usually up to our elbows in blood and making sure that all the wounds are taken care of. It is their job to make sure that the soldiers get the proper nutrition. Somebody with a belly wound, somebody who's very weak, can't eat beef stew. They need beef broth. Most of the kitchens, don't worry about it. Our nurses actually go in and help make sure that each patient gets the diet that they need, as well as helping us maintain the wound dressings, bathe the patients. You say cleanliness is next to godliness, and in some ways it's literally the difference between life and death. We don't know exactly what causes infections, but we know when we keep them clean that it tends to do better for the soldiers.
Yeah, I know.
And
Like,
you know, to add a little bit more to what she was telling you, I was told by a medical professional that what we display here is better than what you get today in our hospitals. There's no side effects with the herbs.